Hi, I'm Liz Burstein, CEO and co-founder of Neura Health, where we are building the future of neurological care. Since the beginning of the pandemic, I've dealt with a deeply trapped nerve, a peripheral neuropathy. My long, difficult patient journey exposed me firsthand to America's public health emergency in neurology. I saw over 40 specialists. I had no dedicated quarterback for my whole experience. I tried over 10 failed injections. I wasted thousands of dollars on useless care. And most surprising of all, I sat on a 6-month wait list in New York City, where we happen to have one of the best densities of specialists. But I am not alone. There are over 130 million Americans who suffer from a neurological condition, 77 million with chronic headache and migraine, 34 million with chronic pain, 7 million with stroke, and millions of others with concussion, epilepsy, dementia, all receiving subpar care. Beyond this, neurological disease costs the United States economy more than $100 billion per year, and that is more spend than cancer, diabetes, cardiovascular disease combined. What underlies this is a massive supply gap, the fact that we only have 21,000 neurologists in the United States. What this means for people in medical deserts and rural areas is that they're driving hours and hours to get in a specialist that they've been waiting months or even years to see. And the patient experience is really subpar. Beyond that wait list, the care itself involves long cycles of trial and error because none of these diseases have a straightforward cure. And the first 20 minutes of an actual neurologist appointment is still wasted and hasn't changed in 20 years. The first 20 minutes are reviewing the same old intake form and asking clarification questions. Think about how precious every minute of that neurologist time is. While we have a massive amount of specialty care companies being built to decrease costs in other high spend areas like Livongo in diabetes, Cricket Health in kidney, Oshi Health in GI, no health tech disruptor has been built to improve neurological outcomes. We have the best team to build this. My background is in biocomputation from Stanford, and I've spent over the past decade leading product teams at Maven Clinic, ZocDoc, and LinkedIn. My co-founder, Samir Madan, spent over the past decade building and launching some of Facebook's core products. And our medical director, Dr. Tom Burke, is a board-certified neurologist and professor of headache medicine from NYU. We've attracted some of the top digital health brands for our talent team across Noom, Parsley Health, One Medical, and the top teammates from academic institutions like Johns Hopkins and Cleveland Clinic. Our mission is to improve access and quality of care for neurologic conditions. And we're tackling this with a 3-phase strategy. Our first phase is that we're building and scaling a consumer app dedicated for patients with chronic headache and migraine, giving them all they need to manage their condition in one place. Our second phase involves selling our product to large health systems and payers to help them cut through their wait lists, monetize them, and help payers lower costs. And our third phase involves commercializing real-world evidence, the data we're collecting in our platform, to pharma companies. This is a repeatable tech and ops playbook that we're scaling from headache to other conditions like pain, epilepsy, and others. Our core patient-facing product launched last July. Patients receive a dedicated symptom journal, giving them all they need to discover their triggers for their headaches, same or next day access to board-certified neurologists, a dedicated care plan that gives them all they need to do in a day towards their path in relief, and a personalized care coach who meets with them every week to tackle associated lifestyle issues in diet, sleep, stress, hydration, and mobility, which all have an impact in the experience of headache. Neura's providers asynchronously monitor our patients' symptoms to make sure they're constantly doing what they can to get them better. Our patients can see relevant symptom diaries, and our providers see the other side of this as they're following them. For the first time, providers are following outcomes as they should be. So far, we've proven outcomes from our consumer launch, and they are unprecedented. Our patients have seen a 45% increase in level of relief, a 75% reduction in headache frequency, a 67% reduction in headache severity, and just a few weeks ago, we were accepted for publication in the peer-reviewed journal Headache. Neura members love our experience. We hear quotes like this every week. For the first time, someone found triggers that they never understood before, and they can really get to the bottom of what's causing their headaches. We've seen over 1,000 patients, and we're growing 23% month over month with a 70 Net Promoter Score. Because of our patient love, we started to commercialize our product with health systems and large pharmaceutical companies. We're currently in contracting with Geisinger Health System, the largest health system in Pennsylvania, for a 6-month, 200-patient pilot, which unlocks a $10 million opportunity. We're in discussions with 2 other large health systems, OSF and Multicare, as well as a large multi-billion-dollar pharma company for our real-world evidence. This year, we're on track to book $2.5 million in ARR. That sums up across our direct-to-consumer revenue, our health systems revenue, and our payer revenue. We're operating in a massive underserved market. Within chronic headache and migraine, just alone, that represents a $38.5 billion TAM. And when you look at all of our addressable neurological conditions, that represents a $130 billion TAM. Our vision is to find cures by learning from the experience of every neurology patient. And while we're doing this, we're building a gold mine of data on neurological outcomes. For the first time, we're centralizing treatment data, symptoms data, and outcomes data, which is incredibly siloed in our current system. Join us on our vision to find cures by learning from the experience of every neurology patient. It is time to do right by our patients and build the first unicorn in neurology. Thank you, and see you on the Demo Day app.